Joy 99.7 FM. Joy 99.7 FM.
We go to Banama planet. I know what I could do more routine. I have me. Dima Temen come to Bona Babe Kame. Boka, my Sam, the Biaminte. Mene, Oka, now say, I'm focused. The best I'm own boss. And ten, one of it. I'll be boss and Ben Amante. They say my songs be a real one. And so till be a just having quan. I know go round from me. Today them say they be. Nani na me da wase. Mama ta phone goes and tells it. Teni pano kamani. Teni pano kamenu fi. Kagete give me the shabby. Kagete give me the shabby. Teni pano kamani. Teni pano kamenu fi.
Joy 99.7 FM.
Praise the Lord, hallelujah, in the highest.
That's right, Ultimate Health on Joy 99.7 FM.
All by your mercy.
Sunday the 30th of January, 2022. Yeah, we do our praise, but we still get it done and have some fun.
Joy 99.7 FM.
So as you know, we've been focusing on cervical cancer awareness, treatment, diagnosis, everything.
OPK classic.
Have you screened yet? If not, why not? So I've got the ladies in the house. Doris Kumiwa Ejay. DDNS Bakupe. Greater Accra Regional Hospital. Reproductive Health Unit. Next to her, I have Dr. Na Ayoko Tego, specialist obstetrician gynecologist, also with the Greater Accra Regional Hospital. Today, we'll touch up on the screening and what's available, especially or particularly at the Greater Accra Regional Hospital. But we'll swing and look at what happens after a positive screening. What if they find something? What happens? And if they actually conclude that it is cervical cancer, what's available for you? Share your experiences, concerns, questions. WhatsApp 055 11 11 997. We're live on Facebook and YouTube. Okay, ladies, you're most welcome.
Thank you.
Oh, I can hardly hear you.
Thank you.
Thank you.
Uh-huh. Right. Doris and Nayoko. Should I call you Dr. Nayoko?
Yes, you can do that.
Dr. Nayoko. Okay, right. You're most welcome. Once again, Ultimate Health on Joy 99.7 FM. With your kind assistance, I've been focusing on cervical cancer for the month of January, right? Despite football, despite everything else, there are things happening in people's lives. And for women in particular, we know cervical cancer is a big issue. One of the most treatable cancers, right? But also one of the most common cancers, right? We've been treating it and understanding what it is, what are the causes, signs and symptoms, and so on and so forth. So we're moving forward. But the important thing last week, Doris, you told us before you left that Greater Accra was going to launch its cervical cancer program. How did that go?
Yes, we did launch our cervical cancer awareness on Monday, the 24th of January.
Right.
And it went very well.
Okay.
A lot of people got to understand what cervical cancer is and what it can do to the woman and how you can prevent it.
Right.
So it went on very well.
So it wasn't just a launch and some
there was
cutting
a presentation.
There was actually, right.
There were interviews and what have you. So, you know, it was a full day and it was really nice.
Okay, great. So we're hoping to get the response, right? And your reproductive health unit in particular is promoting the visual inspection with acetic acid,
Yes.
the VIA.
Yes.
Right. We talked about that last week. So you're smearing the cervix with acetic acid, and then if there are any abnormal cells, they tend to show up
Yes.
whitish or something like that.
Yes, a white lesion or a white patch. we call
Right.
it.
Okay. So all that is screening. Let me come to you, Dr. Nayo Cortego. You know, when we're screening, obviously we're looking out for signs and the potential or the probability that whatever we're screening for exists.
Yeah.
Okay. We talk a lot about screening, right? And we encourage women to screen. We do a lot of education, information, and awareness. But with regard to outcomes, we know if you're negative, you're happy. We know on a regular basis, you're supposed to screen frequently or routinely, right? But what happens if there is a positive screening outcome? What happens?
Okay, so by screening, are you talking about the VIA or just
Any of
also
the screenings which is
any
positive.
of the screening?
Right.
Okay, so if you do a VIA and we have an acetyl white lesion, that's after you put the acetic acid and then there's a white lesion. That's a
Okay.
suspicious lesion.
Okay.
Okay. So at that point, you go ahead and do, still at the family planning unit, you do something called the cryotherapy. That's basically freezing off. You just target the white lesion.
Okay.
Okay. And then you freeze it off. You freeze the cells and then it slops off,
Okay.
basically. So it's basically treating. You've seen a suspicious patch. You freeze it, treat it, and then it will fall off.
Okay.
Okay. That's with the VIA.
Right.
However, if you should do cytology, okay, with cytology, you have the pap smear or the liquid-based
Right.
cytology.
Okay.
So with the pap smear, yes, I don't know if you went through it last
You
week.
go ahead.
but-
Go ahead. Feel
Okay,
free.
sure. So you take the cells and then put it on a slide. It's sent to the lab. They look at it under a microscope to see if there are any abnormal cells
Okay.
in there.
Okay.
Okay. So if someone says, "Oh, my pap smear was negative," that means they didn't see any abnormal cells.
Okay.
Okay. But if the pap smear was positive or suspicious, that means that there were some abnormal cells.
Okay.
With a positive pap smear, the next step would then be for you to do a colposcopy.
Right.
That's a big word, really. It's not a big deal. It's just it's like a microscope.
Right.
Okay, so you just zoom into the vagina cervix, straight onto the cervix, and then you look at the area. Okay, you apply your acetic acid again.
Okay.
Look at the suspicious area. Look at all the characteristics of what's going on, and then you take a biopsy.
Okay.
Send it to the lab, and the pathologist will come back telling you either, oh, it's nothing, probably it's just a low grade dysplasia, abnormal cells. Yes, there are abnormal cells,
Okay.
maybe. So maybe it will mean that you have a low grade of that or you have a high grade.
Okay.
If you have a low grade, there's a management path. And then if you have a high grade, there's something else that we're going to do with that.
All right. Let me ask this question before we move on. So we're dealing with abnormal cells.
Yeah.
Right? In the first instance with the VIA, you said, well, we can freeze them off.
Yes.
Cryotherapy.
Yes.
All right. I guess women listening to us now want to know. So she hasn't mentioned the dreaded word yet. She hasn't said cancer. She's talking about dysplasia,
Yeah.
abnormal cells, right? At what point do you, let a person know, or at what point are we arriving at a conclusive diagnosis which says this is actually cervical cancer, right? So we've talked about the cells. You've sent it to histology or whatever, right? And they've done that. And I want to know at what point is there a diagnosis, right? Okay, I can understand all the process, and I'm sure my listeners can, but they haven't heard cancer. You found something, you've talked of suspicious, abnormal,
Yeah.
right? I've heard dysplasia, right? And so where does the cancer come in? Are we still not at cancer yet?
Okay. So still with the pap smear results, yes, it can tell you about just dysplasia, whether it's
Okay.
low grade, high grade, or sometimes it will even just tell you that it's just some inflammatory cells, maybe those in menopause.
Low
sometimes.
grade what? It's not low grade cancer.
No, it's not low grade. Low grade spam. Okay, I'll just say low grade dysplasia.
Okay.
So like there's still atypical cells, abnormal growth
Okay.
of the cells,
All
but
right.
they are not cancerous.
They are not cancerous.
Yes.
Okay.
So basically,
But they still need attention and management.
yes,
All
they
right.
still need attention
Understood.
and management.
Great.
Okay. So with the dysplasia, that's the abnormal growth of the cells. You can have the low grade, you can have the high grade, and
Okay.
then also pap smear would report whether you have, especially if you do a colposcopy and take a biopsy.
Okay.
Pathologist is going to come back to you and say, okay, yes, this is a squamous cell carcinoma. So it's all based on the tissue diagnosis.
Okay.
And once it comes, yes, you know you are dealing with
All right.
a cancer.
Okay.
Then you go on to your clinical staging, and based on the stage that you derive from your examination, you treat according to stage.
Okay.
Yeah.
All right. If you've just joined us, 16 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. Listen, every Sunday, 2:05, we come alive. My name is Nortey by nature. I'm in the studio with two lovely ladies from the Greater Accra Regional Hospital. I find that a mouthful. I just like saying Ridge Hospital. All right. Doris Ajay is a DDNS, and she's with the Reproductive Health Unit. And you just heard speaking Dr. Na Ayoko Tego. She's a specialist obstetrician gynecologist, also with the Greater Accra Regional Hospital. If you have any questions, concerns, send them to me. WhatsApp 055 11 11 997. We're also live on Facebook and YouTube. Right, so coming back, Doris, we've done this before. We've talked about this. So Dr. Tego mentioned that even with a positive VIA, you are still dealing with, or you are still being managed at the reproductive health unit. So there's some of the things she's talked about that are done also at your unit. At what point would you refer a woman for further investigation based on a positive screening? Or is it all within the same team?
Okay, so we all work in the same team,
All right.
Obs and Gynae, where reproductive health unit falls under.
Okay.
So where at the stage where I'll refer to Dr. Tego will be when the VIA positive, the lesion we're talking about is like a patch
All right.
or a sore.
All right.
So that part, which is, once it becomes bigger, we have, like she's saying, in this way we say percentages.
Okay.
So if it's more than 75%, so if the lesion takes more than 75% of the cervix,
Right.
then I'll refer to her.
Okay. And
That
you have
is
means
where-
of assessing and determining the
Yes,
percentage.
that is where, yes,
Right.
that is where biopsy, that's a piece of the cervix will be taken
Right.
to the lab
Okay.
and they find out if it is really cancerous.
Okay.
But if it's within 75% or low, then we do cryotherapy or cryo treatment where
Okay.
the cervix is frozen and then sheds off the abnormal cells.
Okay.
Again, some women walk in and the cervix feels hard. It bleeds on touch.
Right.
Anything you do to the cervix is bleeding.
Okay.
Or she tells you that when she has sex, she bleeds.
Okay.
Or she's menopause, but she's bleeding anytime.
Right. So
Then that's
postmenopausal
yeah,
bleeding.
postmenopausal bleeding. Then I refer to
Okay.
the doctor.
Okay.
But again, we have to examine and see.
Okay.
Sometimes women are referred from other places to have a pap smear done. And you go into the vagina and there's so much bleeding that nothing can be done about it. Then
Okay.
we refer to the gynecologist
All right.
also. Sometimes you are doing a VIA and the skin or the tissues there are just peeling off or coming off.
Right.
So soft that that one we will not say she has cancer. We still have to find out what is going. It's
Okay.
friable. We say
Okay.
the tissues there are
What's
just
the word again?
Friable.
Friable.
they just tear off.
Okay.
Then that one you know that it's a stage of cancer, but we are not going to tell you or say there that it's cancerous.
It must be confirmed.
We have to have
Right.
a confirmation from a laboratory
Okie
or
dokie.
histopathology.
Right, great stuff. Hi, Na. Okay, this is for Na who has left. Wish my dear husband, Major Sotebaderi Nari Young of the Armored Regiment, a happy birthday in advance. I love him so much from Major. Okay, the wife is also a Major. Trouble. Major Sally Nari Young. Okay, I've shared that. Let me see if there are any specific to what we're discussing. Okay, this is all about music that has gone past. We're talking about cervical cancer now on Ultimate Health. If you have any questions, concerns, experiences, share them with us. WhatsApp 055 11 11 997. We're live on Facebook and YouTube. And shortly, I will activate the phone line so you can talk to Dr. Na Ayoko Tego, specialist obstetrician gynecologist, and Doris Ajay, DDNS with the Reproductive Health Unit. Both of them are with the Greater Accra Regional Hospital, and they are helping us with diagnosis and treatment. Okay, so we have ways of staging or determining the seriousness or the severity of whatever we are seeing and finding, and then we have some, should I say, initial interventions, cryotherapy and a few other things, and then if it exceeds a certain degree, it is referred upwards. At what point are you seeing a specialist, Dr. Tego?
Okay. So from the point where, as DDNS said, they've already seen this lesion.
Okay.
It occupies more than 75%,
All
or
right.
maybe she has all the signs of a suspicious cervix. I
Right.
wouldn't call it cancer because, cancer is a tissue diagnosis.
right. Okay.
So, of a suspicious cervix. At that point, immediately, it's beyond them.
Okay.
They have to refer to the specialist.
Right.
And so we will assess, we'll examine, take a biopsy, do a clinical staging.
Right.
Okay, which includes not just physical examination. You also have to do things like maybe an ultrasound,
Okay.
CT scan of the abdomen, okay, to see whether there are any there's any involvement of the ureters or other things that would indicate at which level
Okay.
the spread has reached.
Right.
Yes.
So these procedures will take some time. So they're not likely to happen the day you had the screening at Doris's end, right?
No,
Okay. At the time you are being referred for this specialist attention, if I can call it that, you still haven't been told as a client or as a patient that there's a problem, or you would be told there's something that needs further investigation. What kind of communication? Because we lose women at various points of this process, either out of fear, misinformation. So I'm trying to get you to give them a sense of how is this communicated.
Okay.
Right.
So ideally, I mean, you've seen the cervix. So I'm speaking from the family planning unit
Right.
point of view. Maybe a midwife has seen the patient. She tried to do maybe a pap smear, VIA, or any kind of screening. Saw a suspicious cervix with all the features DDNS has already described.
Okay.
She has to communicate with her. Obviously, you would have to sit with her.
There's some counseling pre and post.
Yes, pre
Right.
and post counseling.
Right.
Let her know exactly what your suspicion, what you saw,
Okay.
why you couldn't probably continue with what you had set out to do,
Okay.
what your suspicion is, and the way forward.
Okay.
It really is beyond them. So
Right.
you have to talk to her so
Okay.
that she manages her expectation, and then also you allay her fears a little bit, because
Okay.
you can't just send her off with all these questions in
Okay.
her mind. Because sometimes the diagnosis will come out as just something benign.
Okay.
You know.
Okay. So, ladies and indeed gentlemen, as you listen to us, please, these stages of the process are very important, and you need to listen. And it's your body, so you ask the questions the same way I'm probing and bugging them in the studio. Ask the questions and make sure you understand before you leave the facility. Very often they run away and they go, "You see, menyabiu," right? And then there's a lot of panic and stuff like that. If you have any questions, concern 055 11 11 997. We're live on Facebook and YouTube. We're talking about the diagnosis, conclusive diagnosis and treatment options available for cervical cancer. We're still able to give information and education on screening and awareness as well. This is Joy 99.7 FM. So, Doris, let me come back to you before we go into the treatment options. I am coming for screening. Thankfully, it's available, right? I'm responding to the education, particularly during this month. Are there any reasons for which I can't be screened? Is it my age? Are there any contraindications for screening? Okay, or are there things I need to do to prepare for screening or not do?
Okay, so generally, we do the pap smear and the VIA.
Okay.
And VIA is for women in the brackets of age. When I
Okay.
say, what I mean is, VIA can be done for only women between the ages of 25 years to 45 years who have ever had sex.
Sexually active women between the ages of 25.
25 and 45 years.
Okay.
So
Why is that?
because that part of the cervix which can be affected or which can show off the abnormal cells,
Okay.
we call it where the squamous cells, it's a big word, squamous cells of the cervix and the columnar cells meet. It's called a junction. So squamo-columnar junction. That part of the cervix, I can liken it to the lips. So like my red lips, that's the squamo-columnar junction. So in a woman who is 25 to 45 years, that part I'll say is ripe. It's showing.
All right.
But the woman below 25 years and above 45 years, that part is drawn in. Like this, if viewers can see, like this.
I'm using my lips.
So you need to do a pap smear, which has a brush. And you go through that small hole in the cervix to draw out some of the cells. It's not scary. It's not painful.
So this age bracket is because of the developmental changes, right? In the presentation.
And
so the VIA is best suited for women between 25 and 45. All right. Thanks for the clarification.
And then if I can just add on to that
go
before
ahead.
we move on. Another main reason why you don't really bother screening people below that age, maybe below 25, the HPV is a very common sexually transmitted infection. In fact, it's the most common sexually transmitted infection. And for a lot of people, they may even have it. It will don't have any symptoms. It will regress. It will resolve without them even knowing.
Your immune system.
So if you go testing people, I mean at that age too, they have a good immune system and all of that going on. So if at that stage you go screening, you pick up all these positives and all that, initiate treatment, come back and it would have regressed. It would have gone. You know. So that's actually one of the main reasons as well.
Great. All right. Let me hit this one straight. So I'm in my menses or I'm menstruating. Can I come for screening?
No, the blood would not allow you to get your results. So once you are in your period, then you wait till the period is finished. If you are a virgin, of course, you cannot have it because we put a small instrument in the vagina to see the cervix, which is up there. And then if you are pregnant, we don't do VIA mostly. Sometimes a woman is pregnant and her specialist wants to do a pap smear for one reason or the other. But we don't do it as a general service for everybody. So if you are pregnant, if you are in your period, you are a virgin, in a period, then we don't do it for you till you are done.
Too much later. All right.
Ideally, before you come for a pap smear, if you can avoid sex for about 3 days, it is good. But if you can't, it doesn't matter. You can just walk in and we have it done.
Okay. I know some of you just heaved a sigh of relief. Right? But yeah, it's important to know this. But how long after your period can you come?
Oh, just
the next day?
So some people, maybe today is the last day. There's still some blood there. So a day after the normal flow.
Should I wash, bath, douche before I come?
You can take your bath. We don't encourage women to put the finger in the vagina when they are taking their bath. So she can just wash the vulva. It doesn't matter. We go up. It's a high vagina thing.
Great stuff. All right. Good afternoon, Nortey. I did the test in 2011 at the Ridge Hospital and it was negative. I'm now 65 years. Can I do it again? Oh, 2011, you should have done it again,
Yes.
You are 65. You don't do it once and stop. I'm sure my resource persons will emphasize that. This is Mami in a shy man. So she's 65 now. She wants to do it again. What do you say to her?
Okay, so hi, Mami. Thanks for listening in. First of all, after doing your pap smear, what is
2011?
2011, that's what? 11 years
11
ago.
years.
Yeah.
11 years ago. You should have continued with the regular 3 yearly screening. Normally, at 65, we would say that it's safe for you to stop screening, provided over the past 10 years, you've had negative results on all consecutive tests that you did. Then when you reach 65, then you so assuming from 55 to 65, all the 3 yearly tests you were doing came negative. Then at 65 we say you stop. But here's a situation where you did it 10 years ago. So I mean, in short, I think she should test again. And let's see where she's at, and then we'll take it from there.
Thanks for sharing. Please, what time in a woman's cycle can one test? We've kind of sorted that out, right? And then is testing free? I'm going to. All right, Ghanaians love free things. For the VI, it was as low as 30 CDs. It's 30 CDs,
Yeah.
right? Which is what? How much do the hairdressers charge?
I don't know.
Right? That's how I like to relate
About
more
it.
than
50
that.
CDs,
Right.
100 CDs, depending on what you want to
Okay,
do.
your Sunday shada that you go and please, right? But there is provision for free testing of a sort at GRA. Doris, if you can quickly hit on
We
that.
want to do VI for free for about 1 month. So starting from the 1st of February to, let's say, the last day of February.
All right,
In the weekdays.
Okay.
So 9 to 1 p.m.
right,
Just VI.
right. VIA.
And yes,
Right.
the instant test. So
Okay.
we're doing for women who are 25 to 45 years. Last 2 years we did that, and people were reducing their ages. It is not going to help anybody.
So it's not just
because
elections and.
if
this
you
and that we
reduce
put-
your age, you are 50 and you say you are 40, you go in there, we don't see certain things.
the speedometer will show.
Yes. And we don't want to have any argument. We want to treat women nicely.
Okay. And
So
it will eat up your service time.
yes. So when you
Right.
come and you are older than 45, or you are younger than 25, let's say you are 24 but you are sexually active,
Yeah.
can have a pap smear done.
And do the back.
And those above 45, pap smear, which is 140 cedis.
Pap smear is 140
So,
Ghana
yeah.
cedis.
So the
and-
VI
yeah.
we want to just do for just this coming month, and it's 9 to 1 p.m.
All right.
So we
Okay.
will regulate the numbers
Right.
actually because of COVID.
Okay.
We're not going to crash in at least first 50 people.
Right.
would-
Social distancing, everything must be complied with.
Yes. So
but
if the numbers we want for the day is
it's done.
is done, then we are
Then the
done
next
for the day.
Right. Okay.
Yes.
Great stuff. 32 minutes past you have 2 on Joy 99.7 FM. Please, can a man give a woman HPV? Yes.
Yes.
Right. This is from Dagati in DC Petroleum. Right. Indeed, men can also test for HPV. Right. Yep.
Definitely, yes. And then men should also know that it's not HPV doesn't cause just cervical cancer.
Right.
So it's not just about women alone.
There are so many
It can
different
cause
strains.
penile cancer,
Penile
for the
cancer,
men.
oral
It can
cancer.
cause oral cancer, anal cancer. So
Right.
you're not out of the woods.
Okay. Good afternoon. And look at Adiman Joseph. He's calling me Nate. Good afternoon, Nortey. Please ask for me at what age should one be mindful of cervical cancer? You should be mindful at all ages. That
Once
you
you're
can understand.
sexually active.
Yeah,
it's a
but if
sexually
you can
transmitted
understand, even
infection.
at younger ages, they are learning about it. And
Definitely,
yeah,
yeah.
so Ajiman Joseph, that sorts you out. Good afternoon, Norte. Good work. Please, I was diagnosed to have ovarian cyst. I was told it will go by itself. Can it lead to cancer, Doc? Ovarian cyst.
Now we're moving to ovarian.
No, just this specific question. We're not going there.
Well, it depends on the features of the cyst.
Okay.
Okay, it depends on the size. It depends on the features. I mean, if there are septations.
Right.
And if there are any other, maybe ascites, any other abdominal findings. And
Right.
then there's this ovarian cancer, CA125. So
Right.
it also depends on your CA125 level. And of course, your age, whether you're premenopausal or postmenopausal.
All of these things must be determined by the requisite professional.
Yes. So at this point, you probably have to see a specialist. So
Right.
we see your risk of malignancy.
Okay.
Yes.
All right.
Yeah.
Hi, Naughty. I'm listening from Sweden. You're welcome. I'm Baba. I've taken my womb off. Okay. You've had hysterectomy. Can I still do a pap smear? Should I still do a pap smear?
Okay, so my question to, is it Baba?
Baba, yeah, Sweden.
Okay. Hi, Baba. Okay. So it depends on the kind of hysterectomy you had.
Right.
You know, we have subtotal and then the total hysterectomy.
Right.
With a subtotal, we actually leave your cervix in
Right.
for whatever reason. I don't know what the indication for the surgery was. So
Right.
once your cervix is still there, you're still at risk with
Okay.
everybody else.
All right.
So you
need
just
to do a
continue
Yeah.
screening. Yeah.
Okay. On the regular basis.
On the
So,
regular basis,
Baba, you need
everything.
to know the type of hysterectomy that was done.
Yeah.
Was it full, total, which means everything was taken out, or was it partial? And I think the best place to find that out is where you had it, and you should have medical records.
Yeah.
All right. Okay.
She can go to any hospital
For them to do a
for them to
speculum.
do a speculum examination.
speculum-
Some women come in like that, and
Okay.
we want to know, so we do the examination.
All right.
If the cervix is there, fine.
Okay.
If not, then
But women
has to
who
do.
you should know your medical history and you should ask questions, okay?
Not many do actually. So.
Yeah, but I'm encouraging them.
Okay, please do.
We are too known like that on Joy FM.
Please do,
yes,
do.
You see, you should know and find out, right? Because you may find yourself at another facility and you'll be required to help them generate the relevant history. So that's important. So, Baba, we wish you all the best, but go find out. Good afternoon. What's the difference between HPV and HVS?
I think nothing can
Charlotte,
answer that.
I won't answer.
I beg you.
They'll think I'm also a women's plumber like you. I don't go down there. Please explain.
Okay, so HPV stands for human papilloma virus.
Right.
It's the virus that causes cervical cancer, vaginal cancer, vulvar cancer, and all those other cancers we just mentioned. HVS means high vaginal swab. Okay, so basically people who come with vaginal discharge, okay, maybe candidiasis and all these other bacteria down there.
Yeah.
You pass a speculum and then take a swab of it, send it for culture and sensitivity or routine examination to find out what kind of cells are there. And you treat according to what you find. So that's the difference.
Right. Yeah. You see why I didn't want to say it. Ask why does and how does Nortey know about high?
Oh.
Right. Hi, Nortey. This is Baba from Sweden. She said it was a total hysterectomy.
Okay. It was a total hysterectomy.
Okay.
Yeah.
All right. So does she need to do?
Well, it depends. Does she have any symptoms, any suspicion? If you do, then you do something called a vault smear.
Okay.
Okay, because sometimes even when the cervix is taken out, some parts of the cervix may be left behind. And if those parts are malignant or suspicious, they can, even though it's just a little bit, it can still give you the symptoms that everybody else would have.
Okay. So please, if in doubt, go.
Yes, if in doubt, find a specialist somewhere. Yeah.
Dr. Na Ayoko will refund if it is nothing. All right. Right, I'm going to activate the phone line 0302-216-541. Let me quickly recap. You can get free VIA at the Greater Accra Regional Hospital if you are between the ages of 25 and 45. Don't go changing your age. Don't make do those football age things. They call it age doping. Age doping. Don't do that. This one says, hello, Nortey. Please, can I meet the specialist in your studio now? Hey. Susie Ankra. Do you know how I struggle to get her? If there's anything, send it to us. We'll see how we can link you to her. Okay? Right? It's Mami again. Can I visit the hospital next week? I want to travel, but I want to make sure I am fit. So Mami wants to. This is Mami who did it in 2011 and is 65 now. Yeah. Go and ask for. Yes, ask for DDNS Bakumpe. But they're lovely staff there. They are all great. But I have a special crush, but I can't explain that on air. All right. Good afternoon. Can I speak to the doctor? Personally, after the FM station. Wow. All right. We need to see. This is a kind of e-transaction, and there'll be an e-levy for talking to the doctor. If you have anything, send it to us by WhatsApp. Abeku and I have a way of professionally and ethically linking you with professionals. Okay, so we'll do that. If you have something, send it. He will send it and copy to me as well. Right. So the phone line is active 0302-216-541. We've looked at some of the issues. So okay. I do have cervical cancer. I've received my counseling. It's been explained to me. What happens next and what is available?
Okay, so like I said, even though you have a tissue diagnosis, you also have to do a clinical staging, right? So you're going to do all your maneuvers to try and figure out at which stage is this.
Okay.
So with cervical cancer, I'll probably make it very broad. I'll make it 4 stages. Okay.
Right.
There's a stage 0 that I don't think anybody needs to know about.
When you say stages, you're looking at how serious, how bad.
Yes, how far it's spread.
How far it has spread.
Yes. Is it still confined to the cervix or has it moved beyond the cervix?
Okay.
That's what the staging is about.
Okay.
Yeah. So basically, you do your staging. You try and ascertain whether it's confined to the cervix. If it's confined to the cervix, that's stage 1. If it's moved up to the uterus, that's the womb. Okay. That's stage 2.
Right.
If it's moved down to the vagina and probably the side walls of the pelvis, we'll call it stage 3.
Right.
Stage 4, of course, bladder, rectum, invasion. Okay. And then distant spread to liver, lungs, and what have you. Okay. It can go that far. Right. So that would be stage 4. So this is, there are sub-stages under them. Okay. And that determines exactly what treatment you're going to give them.
Dr. Nayoko, let me ask you this. So with these ones, am I going to do lab tests somewhere, receive it myself, and then somebody at the lab can whisper something in my ear. These determinations you're talking about,
No.
they are serious business. Who
Yes.
should be telling and who should be interpreting the investigations?
The only person who can stage this is a specialist who started seeing the case from the beginning.
Okay.
So you have the history.
Right.
And you do your physical examination. Okay. You've done your tissue diagnosis and all that. It's come back, they tell you there's the squamous cell carcinoma or
Yeah.
something like that.
Okay.
You go back, do your physical examination, see the extent. So, I mean, apart from the one who actually did the examination,
Right.
the ancillary tests like the abdominal ultrasound or the a CT scan of the abdomen is just to tell you that, okay, now we've gone beyond stage 2. We
Okay.
are now looking, has it moved to the ureters, to the kidneys and all that. That's why you need that imaging. So anyone who does that imaging cannot put the pieces together.
All right. Okay.
So it's just to aid you to make a conclusive
All right. Okay.
diagnosis.
Great. Please, I did a pap smear a year ago. Can I still do another screening? I'm 47. My name is Gifty.
Was it negative? If it's negative, then 3 years,
3
2
years.
to 3 years,
Okay.
she can have it done.
Right. And if it was positive, she should be in some process.
Yes.
Okay.
Yes.
All right, Gifty. I have a caller on the line. Hello.
Hello.
Yes. Good afternoon.
Good afternoon.
Yes.
I just came back from church and twin. I want to know if there is any symptoms.
If there are any symptoms.
Yes.
Okay. Right. We've talked about this earlier in the stage of the series, but Doris, can you just quickly, or Dr. Na?
Well, yeah. So some of them will be asymptomatic. You may not have symptoms at all, especially in the early stages of the disease.
Okay.
In advanced stages, you may have bleeding, vaginal bleeding, which may be in between menses.
Okay.
It may be following intercourse.
Okay.
It may be postmenopausal. That's when you've had an established menopause and then all of a sudden you start bleeding from the vagina.
Right.
Okay. Apart from the bleeding, you can have vaginal discharge.
Okay.
That's if your cervix is now ulcerated and all that. You can have vaginal discharge.
Okay.
You can also have pain during intercourse.
Okay.
Okay. And then you can have pelvic pain.
All right.
Then, of course, the other cancerous symptoms
Doc,
like
please,
weight
I
loss.
beg you, when we say pelvic pain, is it different from waist pain? Because these things, what do you
Okay.
mean by pelvic pain?
Okay. So
It's like the same thing. Sometimes people say it's not
Abdominal
abdominal pain. It is this.
the pelvic.
What
okay,
is
so
pelvic pain?
Okay. So basically, the pelvis is located. So basically, your lower abdomen. That's what I'll
Lower
call it.
abdomen.
Yes, your lower abdomen.
Okay.
So from the central part, involving the right and the left. Well, it could
Okay.
be either of them or all of them.
Okay.
Okay. So the middle part of your lower abdomen, the right or the left.
All right.
Or all of them.
So if
That's
I had
pelvic.
pain around the pubic triangle,
Yeah.
where I have pubic hair, is
Uh-huh.
it pelvic pain? Is it lower? Whatever.
Well, what would we call that?
Well,
Well, no, but that's part of we'll call it, it's part of the perineum. So rather call it perineal pain and deal with the possible causes of it.
I said not say.
Okay, fine. So
All right.
pelvic pain, it
Okay,
works.
I was trying to get some clarity. Okay, pelvic
Okay,
pain.
yeah.
Right.
Back pain, as you were asking.
Right. Is it related?
It's back pain.
Back
you know,
pain.
it has to do
Lower
with your
back.
bone.
Can you have lower back pain with as a sign or a symptom of possible cervical?
Yeah, you can. I mean, it depends on the degree of spread, but that would
Okay.
be a late symptom.
All right. Okay.
Yeah.
My phone lines are still active, and I'm doing too many of your questions, right? Join us and ask the questions yourself. I have to let them go pretty early or a little earlier because of sports, right? I'm told HPV is a common sexually transmitted infection. May I know if I can get it from toilet seats? Dagati, again, in DC Petroleum.
Oh, it's a sexually transmitted
Okay.
infection. So I think the name speaks for itself.
All right.
Yeah.
Please, what are the signs and symptoms of cervical cancer and what causes it? You see, every Sunday, 2:05, we are live. We've been doing this for the whole month of January, right? We've said that it is strongly and highly related with certain variants of the HPV virus, which is a commonly found sexually transmitted disease, okay? Right? So that's what we look out for, and we look out for the changes. And the signs and symptoms is what we've just been hearing us go through. Let me quickly read another one. This is have issues of not ovulating due to the increase in prolactin levels and will need a specialist, please. If you need a specialist, they are at the hospitals, okay? We do not sign a contract to give their numbers out. And I've said, we will do our best to link you. All right? Okay, you already know your prolactin levels and other things, so you're already in business somewhere else. But we don't mind. This is from Susie. We'll try and see how we can link you. All right? But they are all the required specialists at the facility we are talking about. This is Greater Accra, but other facilities as well. Okay? I have a caller on the line. Hello?
Hey, Uncle Nortey, good afternoon. I hope you are well.
Yes. Is this Ajingo?
Yes, I was.
Okay, one question only. Shoot.
Last week I was asking about the causes. I don't know if it has been touched on. And one question is too much of sex can cause that? And she mentioned asymptomatic. If somebody is having asymptomatic, can it be transmitted to other person?
Asymptomatic. If you have it and it's asymptomatic, can you transmit it? And then you are again asking questions which we answered for you last week, right? Causes, I just gone through that even before you called, Ajingo, right? I don't expect you. You are a regular listener. You should not be saying asymptomatic and things like that. Asymptomatic. Asymptomatic means that the person doesn't show symptoms, but they have the condition. And he's asking if you are in that stage, can you still give it to somebody else? Yes, you can.
Yes.
All right? Okay. 46 minutes past the hour of 2. So we have very little time because we have to shut down for sports. But let's wrap up. There are various interventions based on the staging you talked about.
Yes.
And can you just quickly tell us what is available in Ghana? Because when people hear cancer, they hear of chemotherapy, they hear of radiotherapy, and a few other things.
Yeah.
Is it the same thing?
Yes, it is. So, well, there's primary surgery.
Okay.
Okay, so there's a surgical option. Then there's chemotherapy and then radiotherapy, depending on the stage.
Okay.
Okay, you may not be eligible for all of them.
All right.
Yes. If it's a very, 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 maybe stage 1A1, that's the lowest stage you can have.
Okay.
With that, yes, you can do a primary surgery.
Okay.
Once we send the tissue for histology, depending on the grade and all that of the tumor.
Okay.
We'll determine whether or not we need to add any chemo radiation. That's chemotherapy plus radiation.
Okay.
But then between stage 1A1 and stage 2A, okay, you assess it's case specific,
Right.
basically.
Okay.
And you can do a radical, you can do surgery, radical surgery.
Right.
I can call it that.
Okay.
Right? Radical surgery where you take out the womb, upper vagina, probably the tubes, ovaries, and then still subject the person to chemo radiation.
Okay.
Okay.
Right.
Now beyond stage 2B, I mean that's far advanced.
Right.
You go straight to chemo radiation. You don't really bother with the primary surgery anymore.
Okay.
Yeah.
Now, thanks for giving us the range of things we can do. Probably have to grab you back another time to go into detail. But let's say you've discovered that I have something.
Yeah.
But I still want to have children.
Yeah.
Would that factor in your decisions with regard to how to handle it?
Well, the main thing, the first thing I would consider in my management plan is what's best for you.
Okay.
The stage of the disease.
Right.
So once we've determined what stage it is, of course, if it's an advanced stage where already we are not even going to get the opportunity to go in and do a primary surgery for you, we are going straight to chemo radiation.
Okay.
Then we know that, yes, radiation also has the complication of hitting the ovaries. I mean,
Right.
there are maneuvers you can try
Right.
to avoid that. But
Okay.
then basically it's going to affect your fertility
Right.
because you're going to do external beam and then you're going to do
Okay.
something internal as
Right.
well, which can all eventually get to the ovaries. So
Okay.
yes,
To be taken into
we'll
consideration.
take into consideration, but not before the stage and what's best for you.
Okay.
Yeah.
All right. So what's
Yeah.
best will be done for you, but you do have a say and an input. That's the important thing.
Definitely, you can decline
Right.
anything at any point.
Right.
Yeah, nobody can force you.
Okie dokie. I have pain below my abdomen on my right when I sit for a long time. I've complained to a doctor and I've done a scan. They say nothing, there's nothing there. So please, can it be because of the ovarian cyst? This is Jennifer again in Kaswa. She asked if the ovarian cyst
Is
can...
it the cyst, the one who
Yes,
asked about the
she
cyst?
asked earlier.
Yes, a cyst can cause pain.
Right.
Yeah, especially if it's undergoing slow torsion, like twisting.
It's twisting.
If it's twisting, yes,
and
it
it's
can
not
begin
getting...
to give you pain. Yes.
Right, okay.
Yes.
Great. So, Jennifer, you will need to see somebody to check some of these things you're talking about.
I think she needs to
Okay?
address that.
All right. So, we're still in good business. Nortey, I was negative 10 years ago. I haven't had sexual intercourse since then. Do I need to do the test again? All right. This is Mami. who wanted to do it before she travels. Oh, this is still the same 65-year-old woman,
But we
right?
told mommy to come to.
Yeah, you go to Ridge,
Yeah, find Didi and
right?
she'll sort
Okay.
you out.
So, mommy will take special interest and make sure you are able to travel like you plan. But I'm glad you are quite comfortable sharing and helping us to learn and grow as well. At what age is the HPV vaccine given?
Okay, so ideally, you'd want. Oh, Didi, do you want to take it?
You can talk.
Oh, okay.
Yeah.
So ideally, you'd want to target people between the ages of, females between the ages of 9 and 14.
Okay.
That's the best time to give them the vaccine.
Females between the ages of
9 years
Okay.
and 14.
All right.
According to WHO, that's the best age range.
Okay.
But that doesn't mean that beyond 14 or 15 going you can't give.
Okay.
So if we miss that window between 15 and 26, it's still a good time to give the vaccine.
Okie dokie. All right, it's what 10 minutes to 3. I promise to give the the sports team some breather because the time for the match has changed slightly, so we'll accommodate them. But just quickly, last words, Doris. So you have freebies coming up from the 1st of February
yeah.
at the Greater Accra Regional Hospital for women between the ages of 25 and 45 who wish to do the VIA, right? But women in that range can also do pap smear.
Yes.
Okay.
So from age 21, anybody at all can do pap smear.
Okay.
But VIA is just for that bracket
Okay.
of women in that age.
Okay.
So anybody at all can do pap smear, but not everybody can do VIA.
Okay. All right. Great. Anything else they need to know? They shouldn't be in their menses.
They should
shouldn't-
not be in
right.
their menses. They should not be virgin.
Okay.
They shouldn't be virgins. And
It's a sexually transmitted.
yes. So if you've never
infection,
had
so
sex, then
you have
there's no
business.
point coming in
All
there.
right. Okay.
And then we
And
are ready
if you
for
have an active vaginal infection as well,
Yes.
you
Right.
want to wait for it to resolve before you come because it could
Okay.
obscure the findings.
But
on the
sometimes they
microscope.
don't know.
They
so
don't
when
even
they
know.
come, then we give them
All right.
treatment. Yeah.
Okay.
So-
And you're going to do the best you can to screen as many women as you
Yes,
can, both
and-
free and paying.
Yes.
Right.
And don't rush in. There's COVID around. When you come, just
You don't want
take
congestion.
it easy.
All right.
Once we say we've hit the number we want,
come the
just
next time.
calmly you come the next day.
Okay.
We'll
Great
see
stuff.
how best we can, regulate the flow.
All right. Great. Any last words from you, Dr. Nayo Kotego?
Well, I'd say that unlike the other gynecological cancers, cervical cancer has an obvious cause, and it's a sexually transmitted infection.
Okay.
Okay. So as much as possible, let's try and educate people. Let's try and prevent this infection. And even if you are sexually active, let's, come to the reproductive health units of any facility.
All right.
Get your regular screening because it's preventable. I don't see why anybody should die from cervical cancer. No.
Okay, sadly, we're losing close to 1,700 women yearly to cervical cancer, and we're recording close to 2,800 cases yearly, right? So highly treatable, highly preventable, and manageable. So why should we allow anybody to die, even if you are paying 30 Ghana cedis to be screened? Please go. We'll see if we can squeeze in one more on cervical cancer on the actual management techniques, right? Many thanks once again, Dr. Nayoko Tego, specialist obstetrician gynecologist with the Ridge Hospital, Greater Accra Regional Hospital, and Doris Ajay, DDNS with the reproductive health unit of the same hospital. Many thanks for enriching our program and educating us. I hand over now to the sports team. I know there's soccer somewhere. So my seat is gone. My name is Nortey by nature. I'm out.